When you sit down with a person and you're planning something, especially something dangerous, they really want to know two things. Remember. Know when you don't know. I've had people ask me if I believe in God. They've asked me if I'm a person of faith. You have to know the limits. What is it you're trying to fix? Because you're fixing people, not pictures.
How do you approach decision making when dealing with complex cases that require creative ideas? Are we ready?
I'm ready.
What's up, guys? Welcome to another segment of the Red Book Podcast, where we delve into fascinating careers and learn the stories and journeys behind them, from perseverance to success. Today, I'm your host, Eugene Engman, and we have the privilege of having Dr. Schmatz with us today.
Good morning.
He's an interventional radiologist, and we are going to learn his story. But first, our sponsors.
Hi, everyone. My name is Jessica Lanehart. I am the operating partner at Chick-fil-A of Ammon, and I've worked here for 10 years. And I love Chick-fil-A, and I love our community. Here at Chick-fil-A of Ammon, we are really excited to announce a partnership between us and the Red Book Podcast. The Red Book Podcast is a show dedicated to show inspiring stories of perseverance and success of real people here in our community. We believe at Chick-fil-A of Ammon that the Red Book Podcast aligns with our values. So we hope you all tune into the Red Book Podcast with us and watch these inspiring stories of our community, and a word from their sponsor every now and again, because we might offer something fun.
What's up, guys? Before we go back to the podcast, I would like to read Dr. Schmatz's bio with you. Please bear with me. It's long, but it tells you how much value he's bringing to the table and how serious we should take his words as we go through the podcast. So here is his bio. Today, we have the honor of welcoming Dr. James Schmatz, a distinguished neuroradiologist and interventional radiologist with nearly 30 years of medical experience. Dr. Schmatz earned his Bachelor of Science in Biology and his medical degree at the University of Utah, graduating summa cum laude and receiving multiple scholarships and awards, including the Richard Jensen Surgery Scholarship, the Charles Hensel Otolaryngology Scholarship, and recognition as the outstanding medical student in his class. He was also elected to several of the nation's most prestigious academic honor societies, including Alpha Omega Alpha, Phi Beta Kappa, Phi Kappa Phi, and the Golden Key Society. He went on to complete his residency and fellowship in radiology and neuroradiology at the University of Washington, where he was named the Radiology Fellow of the Year in 1997. Since then, he's practiced with Medical Imaging Associates, where his clinical expertise spans advanced neurointerventional and vascular procedures, from stroke, thrombectomy, and carotid stenting to cancer therapies, venous disease interventions, and chronic pain management. Dr. Schmatz is board certified by the American Board of Radiology with a certificate of added qualification in neuroradiology. He is an active member of leading professional societies, including the American College of Radiology, the Radiological Society of North America, the American Society of Neuroradiology, the Society of Interventional Radiology, and the American Medical Association. His leadership has extended to serving as president of the Idaho chapter of the American College of Radiology, president of the Idaho Falls Medical Society, and chairing multiple hospital committees. He has also represented the radiology community before Congress, advocating for legislation shaping the future of medicine. Outside the hospital, Dr. Schmatz has dedicated himself to service as the president of the Grand Teton Council for Scouting America, as an organizer of interfaith community activity projects, and as a group leader supporting addiction recovery efforts in Idaho Falls. His career reflects excellence in medicine, leadership in professional and civic organizations, and a deep commitment to improving both healthcare and his community. Please join me in welcoming Dr. Schmatz to the podcast. Catch you on the other side. See ya. Welcome back. Isn't you or am I feeling radioactively too hot? Maybe it's because of the topic we are going to delve in. Dr. Schmatz, thank you very much for being here today.
Happy to be here.
For those of us watching and listening, can you tell us what is interventional radiology?
Interventional radiology, simply said, is the use of imaging modalities, different kinds, to perform minimally invasive procedures. So it's surgery, but it's surgery from the inside using ultrasound, using fluoroscopy, CAT scans, using MRI, all of those things. Minimally invasive in that you don't open up the body necessarily to do the work. You work from the inside and using all those modalities to accomplish it. For example, if you have blocked arteries,
Okay.
you don't open up the body to get at the arteries. You go through some other artery entryway and go from above or below the blockage, and you get across the blockage, open it up, often with an angioplasty balloon, and then it stays open, often when you stent it. That's an example.
You know, when I was growing up, I went through different phases of careers. For example, I wanted to be a firefighter or a pilot or a bus driver.
Yep.
Did you always want to be an interventional radiologist?
No, as a young man, I'm from California, the coast, and so surfing was my desire when I was a young man, but there's very few career opportunities professionally in surfing. But always throughout my life, I've been very interested in math, in science, and in people. And my wife is the one in the middle of college who suggested that I think about going to medical school to be a doctor. I hadn't thought of it before. Once I was in medical school, I was exposed to all kinds of interesting careers. I took a test, actually, that told me I would be naturally good at cardiothoracic surgery or psychiatry. Those seem pretty far apart from each other. But as I went through the medical training, your pathways open up in all kinds of unexpected ways, and radiology was what I got into. But even in the middle of radiology, after medical school, I saw that there are all kinds of ways to practice radiology, including doing the minimally invasive surgery, which was fascinating. So in my fellowship, I narrowed it down a little bit more into my interest in neuroradiology and fixing arteries of the brain, the spine, and so on. So I can do all those things, but I also do the body interventional work too. So it was a journey. I think you have to be open, be flexible as you go through life and realize there's not just one path. There's many paths, and you choose.
I like the fact that you iterate there's many parts. Explore them and see what works best for you. During our conversation, you just said that your wife was instrumental in pursuing interventional radiology, in telling you that, yes, you'll be good at such a field. In other words, it's very good to have a support system, right?
Absolutely. And the support system is your family, of course it is, but it's also everyone you work with. You're wise to listen to the people who work with you. My nurses, my techs, they're all smart people. And when we do procedures, they tell me what they think because I ask them to. They're very good influences on good outcomes.
In your career, how has mentorship played a role in your success?
You need mentors. You need not just people who teach you skills. You need people who teach you their viewpoint of life. And all along the way, I've had people before medical school, during medical school, in the residency at the University of Washington, in the fellowship, and all along the career, people who had wise things to say, not just about medicine, but about life in general. Those conversations, actually, even with patients can be mentors and teach you while you're helping them to perform better medicine. So you need the input of all kinds of people all around you to do your best work.
Even those who come to you seeking help can be your mentors. I like that you mentioned that. Do you have any specific example you'd like to give where maybe a patient had said something you hadn't thought about or had mentored you in an indirect way?
I think over time, not just one person in particular, but when you sit down with a person and you're planning something, especially something dangerous, they really want to know two things, whether you say them out loud or not. One is that you know what you're doing, you've done it before, but also they want to know that you care what happens to them. You care about the outcomes. So in terms of patients teaching me, they've taught me what it means to get better. And that's different for everybody. But they want to live a full life. And that's my job, to be kind and help them live the full life that I can help them.
Thank you very much. It's not about what you do. It's about how you affect the people and how you care about those you help. I like that. Thank you so much. Now, let's go into what are the most essential skills or qualities needed to succeed as an interventional radiologist?
I think you need hand-eye coordination. Obviously, you need that, but you need a knowledge of anatomy. You need a knowledge of pathology. In other words, you need to know what normal looks like and what abnormal looks like. Then you need to know what people have done to fix the problems in times past. That's where research and reading journals and going to lectures, seminars, and conferences, you listen to other people, how they've dealt with the problem, and you get your own ideas about what to do. You need to know the equipment that's available, the different kinds of catheters and guide wires, stents, balloons, freezing and heating devices, all kinds of things you can use to solve the problem. And I think then when you get to that point, you also have to focus on what you're trying to fix and what success means. Fixing a picture is not necessarily fixing a patient. So getting an artery open that it won't help people is a lot of money, a lot of effort for no gain. So you have to know the limits. What is it you're trying to fix? Because you're fixing people, not pictures.
Thank you very much. You are fixing people, not pictures. And you just answered my next question in how do you stay up to date with the current advances in the field of interventional radiology? You mentioned reading journals. You mentioned getting used to work that people have done in the past. How did they succeed? Where did they not succeed? And how can you even improve it?
It's exactly.
Are there any other things you would like to mention?
You go to conferences, you can attend seminars. So many of these seminars are offered by the people who make these special tools to teach you how to use them, and again, to use good judgment in using them. So there are all kinds of experiences. Plus, you talk to people. I think, again, your techs, your nurses, they have things to offer when you're trying to fix things. So it's a team effort with journals, a team effort with conferences, all of those things. And staying humble to realize that the field is changing. What I use today wasn't even invented when I started. And every 5 years or less, much less, the changes come. And you have to stay current so you know what's new, what's available, what works, what doesn't work.
Thank you. Be humble, stay current, and learn to take advice from those you work with.
Absolutely.
In the field of interventional radiology, you are exposed to a lot of, I don't use the word things, you're exposed to a lot of scenarios.
Yes.
And can you tell us about a scenario that has impacted your life, a story?
Sure.
That, you look at and you realize that, whoa, I'm glad I took this step, or an incident that just stuck with you as you went through this journey of interventional radiology?
There are lots of cases that are attached to people. So you think about cases where you learned a lot, but they're attached to the lives of people. One in particular was interesting in that a person had terrible cirrhosis. Their liver was so small, it was not possible to cross through the liver to reestablish a connection between the veins that drain the gut and the veins that go back to the heart in a normal way. And so I would say I think there's inspiration behind what we do as well. And I didn't have a dream, but I had a feeling of how to do it differently than usual. Instead of coming from above through the neck to go across the liver, I decided to try to come from below through a vein of the leg and come through a vein that is only present about 10 or 15% of the time, and come from below to go through the liver and make that connection. And the person did very well. The outcome was great. But my technologist said that I should publish this. And I said, if I've done it, probably somebody else has too. And we went back through the literature and found a very famous radiologist from times past had gone through the same process, but it took her a little longer to get to the point I was at. I didn't have the advantage of her study because it was only a case study. I hadn't looked it up. But the fact that we figured out how to do it on the fly, to solve the problem. I think there's inspiration that's behind much that we do as well. You're helped along to succeed, not just by science, but by faith.
Thank you very much. I like how you bridged science and faith. There's inspiration out there. I've come across this saying that says that when you put your faith in something much higher,
Yes.
you are more likely to gain inspiration and you are more likely to grow.
I think that's right.
And go ahead, sorry.
Well, I've had people ask me if I believe in God. They've asked me if I'm a person of faith. Before I do a procedure, I've had a few people say, Doctor, I want you to pray for us and pray for the procedure or even give me a blessing. And I've even had people come to me when I did something pretty difficult. I told them, I don't know that this will work. And when it did, which is what you always hope for, the family has told me, Doctor, we've been praying for you while you were doing the procedure. And I guess in some humor, I tell them, yeah, I felt my hands kind of warm up there. Thank you.
Thank you very much. Your faith can play a pivotal role in your success.
Yes.
Thank you. Now let's go to the dreaded but rewarding medical school. When you look at medical school, I've heard so many stories about stress, about anxiety, about students having to, go through strenuous situations. How did you handle the stress of medical school?
Well, the best thing was that I was married and I already had some kids. So when I went home at night, my children did not care about the environment I come from. They wanted to dance to the music or play. So that was an obvious release as when I got home. I had to study, but I studied early in the morning so I could play with them when I came home. But I think in medical school, because so much of your reward is performance-based, exams, other ways of measuring you, that people do build up stress. I think you have to keep your head on straight and realize you've chosen a field where every day you're going to go into work, you're going to try to help people. You're not an adversary of anybody. And so that should be an outlook that helps people in medical school realize my duty here is to get as much knowledge as I can, much understanding, so I can help. And that takes a lot of stress off. You'll do fine. Relax.
Thank you. Did you hear my medical student? You will do fine, relax. I like how you look at the positive side. Instead of looking at this as something which is stressful, look at it as something which allows you to help other people, which allows you to build yourself.
And it's a privilege, too, to be there. I always thought of that every day. I am fortunate to be with all these other smart people, smarter than I am, I thought.
Well, I think you're pretty smart. Whilst you were talking, I picked up some points. You said you studied in the morning so that when you came home, you could play with your kids or have time for your family. And so make intentional decisions.
Mm-hmm.
How did you get into that routine?
Well, I study better anyway in the morning. So getting up at 5 o'clock and studying ahead of time, I studied for what we were going to be taught that day so that my mind was already in tune for what was coming. I retained the information lots better by thinking about it ahead of time. So that was a good habit to be in. And again, my children, they needed to learn to ride bikes. They wanted to dance to music. They wanted to do other things besides medical school. So I could do that when I came home.
Thank you very much. How do you approach decision-making when dealing with complex cases that require creative ideas?
I think fundamentally you need to understand the anatomy involved, the relevant anatomy, whatever it is. If you're working on the brain, if you're working on the heart, or the spine, or the gut, or the liver, the kidneys, whatever it is, understand the anatomy and understand what normal looks like, normal physiology, and understand the problem you're being presented with. So the pathology, you need to understand that too. You also need to understand what it is you can reasonably do to improve the situation. I'll give you one example. We used to, for years, fix arteries on kidneys that had been narrowed a very long time in older people, thinking that if we opened up the artery to the kidney, blood flow would increase. Yes, it would do that, but the idea was that you would improve somebody's high blood pressure or even the kidney's function. Well, it turns out if people had been sick for a long time, had those arteries narrow a long time, then opening it was just fixing a picture. They never really got any better. So understanding the problem and what's reasonable to do is part of your planning. And for complex problems, sometimes you have to think of new ways to get at it, choose a different route to get at it. If somebody doesn't have normal veins to put in a central catheter in their neck and their arms, then you sometimes have to think of another way to do it. Again, the knowledge of anatomy and knowledge of what tools you've got and what success looks like is essential. And always, my techs and nurses remind me, Dr. Schmutz, we're not fixing pictures, we're fixing people. Remember what we're trying to fix.
Thank you very much. Before we go on, if you haven't liked or subscribed to this page, please do. You don't want to miss interesting and engaging stories that we talk about. Dr. Schmutz, let's talk about misconceptions in radiology. Do you know if there are any misconceptions and if you'd like to address them?
There are. There are all kinds of radiologists to begin with. There are radiologists who look at pictures, just interpret them, find the problem, describe it, and sometimes offer suggestions about how to deal with it. There are other radiologists who not only identify the problem, but work with others to fix it. And so this is always a team effort. I think one misconception about radiology is that we just look at pictures. But most people do understand what interventional radiology is, especially the other specialties like the cardiologist, the nephrologist, the urologist, all different specialists. They understand what we do, and we are more than just a consultation for them. We work with them to solve the problem, but we have our own clinics, so we see people after the procedure and take care of them too. We see people before the procedure, so we help them with their general medical management. I think a misconception about this is that somehow we operate independent. We never do. We're part of the team, and the best first choice is that the vascular surgeons, the cardiologists, the radiologist, the interventional radiologist, the oncologist, all of us should be working together for the common goal of improving the patient's well-being.
I keep hearing a lot about teamwork.
Yes.
Teamwork is vital for overall success.
Yes.
Thank you very much. A few questions. What is the most challenging part of your training?
Probably just keeping up. There is so much volume of new information. And I have to say, not all solutions are surgical. Not all of them are. Sometimes the best first choice for people is medical management. Years ago, there was a study comparing what I do, opening up arteries, for example, to the legs that have been blocked for a while, versus just putting them on a regimen of exercise. And the studies show that actually the outcomes on some measurements were as good or better if you just put them on an exercise program rather than going through the effort, all of the time, all of the equipment, the expense of trying to open arteries. So you mentioned before, humility is important, and it is. You need to realize I don't know everything and I can learn more. So the challenging part of what I do is new equipment is always coming down the pike. Great tools. We have suction catheters now that will pull a clot out of an artery to the brain and restore people who are having a stroke. These things are always being refined. The use of these things properly takes time and effort and humility to realize there's more out there and I got to be ready for it.
And so, folks, humility, teamwork, and keeping up with what's going on in your field allow you to have success. Dr. Schmutz, we are at the end of our podcast. If you could see your kid self or your little self today, what would you tell them about interventional radiology or about pursuing their dreams?
I would say that you can do almost anything. I didn't start college till I was 26. So I was one of the older medical students too. Anything is possible with your perseverance. Stay with it. Do what you enjoy. Don't ever be discouraged by the amount of time, the amount of schooling to get what you want to do. Because you'll get there anyway. 10 years of school, so what? Christmas comes every year anyway, so what? You will get to what you enjoy doing for a living, whatever it is. Don't be discouraged by the amount of school that you're being asked to do, and I wasn't. Stay with it give your best efforts for people, and the door's open for you if you'll do that. And always remember, people are number one. You're trying to help the lives of the people around you no matter what you're doing.
And so, Dr. Schmatz, what are some takeaways that you would like our listeners to know in terms of achieving success, in terms of learning and continually growing?
I think in any kind of pursuit you're in, mine especially, when you're learning, the best way to learn is to think, how will I teach this to someone else? It helps you organize your mind around the information that you're receiving so you don't just dump it when you're all done. Think about, how can I teach this to others? Also, probably one of the most important things in any pursuit that we're undergoing, especially what I do if it's a life-saving or potentially life-ending procedure. Remember, know when you don't know. In other words, know the limits and be willing and humble to discuss it with everyone around you, but know when you don't know something and feel confident when you do.
Thank you very much. Know when you don't know something, but when you do, be confident that you do. Thank you very much. It's been a pleasure having you today.
Thank you. Nice to see you.
And so, folks, we've learned a lot about humility, teamwork. We've learned a lot about keeping up with your field so that you know what advances are taking place. And like Dr. Schmatz said, always do what you love and realize that it's okay to pay the price now. The end would always be in sight and you will get there. Thank you for sticking around with us. This is the Red Book Podcast. I'll catch you guys on the next episode. See ya.